we'll talk a little bit about uni life first. So you guys graduated in 2017. How was it for you going through the course and through UTAS?
It's been a storm.
Go, Craig.
What's your advice? How did talk me through it?
So uni life for me was brand new. It was about 10 years out of school before coming back into university to do this degree. So I had to learn how to learn again, and that was quite a challenging feat on its own. And what I did in that process, I generated a little bit too much pressure for myself, a competitive nature. All my co-workers and students around me, I started scaling myself against them, which I think would be a natural process. But what it did was it created a lot of additional pressure that really just wasn't necessary. So
I suppose when you're talking about that, it's more, you guys are all in it together. Like at the end of the day, like you've all got to get through the same course. Working with each other and working together is definitely going to be a positive and help.
Absolutely, because you get along with your peers so much strongly when you're in that environment. I mean, doing the UTAS degree, it's quite different to other ones, how it's fast tracked. So you are on campus or with the current world off campus a lot, but you do interact a lot more. So I found uni amazing, to be honest. It is what you get out of it and what you put into it as well. So from out of it, I mean, still pretty much we had quite a small cohort. I think it was about start off with 100 or something, and obviously you lose a couple.
It's pretty much the same each year, so it'll be the same this year too. Yeah.
Yeah, so I found it amazing. I mean, it's obviously a massive adjustment. I'm quite similar to Craig. Yeah, I was quite a few years, and I was living overseas for 6 or 7 years before I came back and started studying. And even the little things like learning to reference and stuff was even a challenge at the start.
Yeah.
But you look after yourself and put in the work, and having you guys as a further support network on top, like you, CL, Sally. I'm not sure the whole team there now, but I'm assuming it's the same. And Susie, of course. You guys are always there to knock on the door or send an email. And I think at the start, you don't, from a perception point of view, you don't really want to access those services because you don't want to look like you're failing or falling behind in comparison to your peers. But then you realise you are all in the exact same boat. And you get so much more out of just chatting to you guys or chatting to your peers. And what do you think? Just see you're on the right path, effectively.
And it's interesting to know when you're talking about assistance, me being an academic and I've worked at UTAS for 5 years, I still go and see Caroline to help me reference. So
yeah, I've seen you do it.
Nobody's above getting help and assistance. And honestly, like it makes everything so much easier. And if you've got the support there, use it.
And it's funny we talk about this because I still do this on road. Even a job I know, in most services, I've worked for a couple now, there's always the option to phone a friend. And I even discuss my decision making with guys who it's their first day on the road just to confirm you're on the right path or to see if you missed anything, rule out that confirmation bias as well. So it's funny that they promote looking for assistance while at uni, but you do that when you're actually on the road as well. So a lot of the skills you learn in uni, you coincidentally utilize them when you graduate
and having that attitude is definitely going to do you well when you're actually working on road for that reason, because all of us can seek clarification and we all work together. No matter where I am, no matter what I'm doing, I always confer with the people around me whenever I'm treating a patient to make sure everyone's happy with the way things are running. And, no matter how much experience you've got, whether you're a trainee or whether you've got 20 years or 40 years on the road, it's the same. You've got to check in.
You watch the best clinicians operate, and the consultants. Having worked in London for a few years as well, and watching all the HEMS consultants over there as well, and they've got 40 years experience, but they'll still confirm, hey guys, have we missed anything? Is everyone happy with the plan? And I think that's effectively best practice, isn't it? Yeah, so that's good.
So we might actually take this opportunity, because we're just talking about that now, as far as work experience goes. So you guys graduated in 2017. So since then, I'll start with you, Craig. You have been working in the Northern Territory. So that is a very interesting place to be working as a paramedic.
Yeah, so being in my third year now, it is 2 years in Alice Springs and it's 2 years, a single year in Darwin. So very challenging service. The service itself is at its infancy. So it was a hit the ground running kind of approach into my grad year. They were still trying to figure out grad programs, and it was very self-taught, self-educated. So a little daunting when you're sitting behind the driver's seat and you're learning everything simultaneously, and it's quite a big job and big workload. There was a lot going on very, very quickly into the career.
Yeah, it's interesting though, because you have the same type of mentality and the same work as you go and learn as you go through university and when you go out on road, and it never changes no matter where you work. Even if you work in the Northern Territory, in the UK, in Sydney, it's the same. Like you in Hobart, you can't know everything, can you? Really?
Not at all. Like the amount of information that you forget along the way. You come through university at a peak of education, and here and there little bits just start falling away, or you select what you need to know. And as you and Tommy both said, the biggest resource you have are your co-workers and other students that have graduated through different services, and picking up that phone when things are getting a little tight it's just invaluable. So yeah, the people that you're sitting next to now in the classroom day one are going to be your biggest tool set later, 2-3 years down the track.
100%.
Yeah, keep
100%.
close. Yeah, keep tight. Keep those people nice and close. And
yeah. That you end up being some of the best friends that you have in your whole life, really. The people.
Well,
I love you, Craig.
I love you, Tommy.
So it was, you just said before, and I want to get you to go through this again. So when we're talking about the Northern Territory Ambulance Service, so can you go through how many vehicles and the size of the service, just so we have an idea, and what that service is, and give me an idea about the type of calls that you get called to?
All right. So in Alice Springs, there was only 2 ambulance and 1 ICP operating at any point in time. And our call out distance would be up to 400 kilometers. So
wow.
Yeah, very remote, very rural, isolated, insulated. We're dealing with demographics from all over the world. So we're dealing with cultural blocks, language blocks, dialects, heavily Indigenous health, which is amazing for anybody that's ever been interested in that. I strongly advise that this will be some of the best work and cultural immersion that you can ever do. It wouldn't be a strange day for me to go single respond to a resus or a cardiac arrest by myself. My biggest job was 70 kilometers out of Alice Springs. I was in the desert by myself. I had a satellite phone that wasn't connecting, and I was doing a resus for a gentleman that had absconded from hospital earlier that day. So
wow,
it's big work. It's, utilizing bystanders. It's utilizing other people around you to do the job that you would want other paramedics to be working on with you.
So how long were you on scene with that patient for on your own?
On my own, that went for about 2 hours because I was already in the area. And what I had to do was locate the patient firstly, who was in a state of hypoxic confusion. So he had wandered off into the desert. So it was a bit of a challenge even locating the gentleman. And then it was being with him as he peri-arrested into cardiac arrest, into CPR. And then from that point forward, it was remaining with this patient while cultural circumstances would then occur, and then trying to relocate the body of this person.
I think I suppose the one thing I want to highlight here in this position is talking about how you're in a situation where you're caring for someone, you've only got limited resources on scene.
Yeah.
And unfortunately, you can't control everything that your presented with. How did you cope as far as like emotionally dealing with a situation where someone was critically ill and pretty much died in front of you?
Yeah, this is probably one of the most stressful events I've ever had to endure. Being so far from town, being so far from help, this was a poor outcome for the patient, but also like you could feel the pressure. It was palpable, it was very stressful, and it was learning how to, again, just how invaluable it is to pick up that phone and to be able to call people like yourself, like Tommy, call friends that are in the same industry. So
yeah,
they're really difficult, those jobs, aren't they? And purely, but then at the same time, like as you would have done, Craig, and you know yourself, like, just comes down to the basics and what we've learned in first aid. All we can really do is compressions and wait for help to come, and that's all that patient needs: compressions and effective shocks where appropriate. So yeah, I've been in similar situations myself where the resources just aren't there to effectively manage the scene, and it can be extremely stressful. But and man, you've spoken this before in the past, Craig, that it just comes down to what your basics, and start from the start and just doing what you can do, and hopefully help will come in that situation. And it's as simple as managing A, B's and C's. And if they do arrest, doing compressions and shocking. And as you said perfectly, Craig, utilising the resources around you, getting a capable bystander to do compressions while you manage the airway or doing something. Not worry about the drugs, not worry about anything else. Just do the essentials, and then once help comes, then reevaluate from there. Yeah.
And I think the most important thing in that situation is just making sure that you stay calm and not let yourself get flustered, and also take the time afterwards to debrief and go through the situation and make sure that you've dealt with it or process it properly. I think that's a really important thing. Tommy, do you want to talk about your experience, which is going to be vastly different than what Craig's is?
Yeah, so I took the option to go to London after uni. I was in my final placement with UTAS with a really, still a mentor today, Cameron Power, his name was. He surely wouldn't mind me saying his name, but he worked on the choppers and was a special access paramedic up at Newcastle. And I had both options there, and I wasn't sure what to choose at the time. And he sort of said, mate, what's working for another service at 3 years out of your whole career? You'll never regret going to London. And obviously I appreciate London's not for everyone. If you've got kids or your own personal circumstances, it's not going to work. But I couldn't recommend it highly to anyone there who is listening right now, who is single, or they can go there with their partner, who's not tied into a house or kids back here, because the experience and exposure you get over there is just, it's amazing. It makes you grow so much as a clinician, what you do manage over there, and the amount of sick people you see. I've often been told that like 1 year in London is the equivalent of like 3 years or 2 years for other services back here in Australia. And yeah, I support that in every way. So I did just shy of 3 years with London, and I've since just relocated to Perth, where we operate as a registered paramedic here with St John Ambulance in the metro region as well.
So what's the difference? Can you give us a bit of a comparison with London and Perth and WA?
Yeah, so London, I was based in East London, and there's a lot of trauma around there. So low socioeconomic, a lot of gangs. So with that come a lot of knife crime. I think London, when I was there, had just taken over New York in terms of murder per capita. So it wouldn't be unusual to do a stabbing each set of 4 you're on, or a bad shooting as well. London is really good because it made you grow as a clinician. A lot of referral pathways over there, so really big on hospital avoidance, as there's one big system. So we had so much different referral pathways we can go to and effectively activate to try and keep that patient out of hospital where appropriate. Of course, decreasing the burden on the system as well. But as I said,
and directing people to where they need to go earlier rather than waiting until you get referrals in hospital, which, can delay 12, 24, 48 hours or whatever.
Exactly, and more appropriately as well. I mean, if a patient's got an isolated fracture or dislocation, do they need to be in ED? No, they probably just need to go straight to an urgent care centre for an X-ray and some further help from there, or getting some pre-hospital antibiotics to fix that UTI. And it's a perfect mixture of primary healthcare and community care. as well as really advanced sick people.
Yeah.
It wouldn't be uncommon for me to go to a nursing home or to pick up an old lady off the ground, have a chat to her, then the next job, do a guy that's been stabbed 20 times and then someone's had acid in their face, and then the job after that, go back to someone who's, fallen over again. So you really do get a wide spectrum of sickness over there.
Yeah. Is that just
is
where you were
amazing.
located, or is that pretty much right throughout London? Did you find that?
I think it's right throughout London. I know East London, where I am, is known for being like more trauma, just due to the areas of where we were located. But I think wherever you are in London right now, you're going to get that exposure to those jobs.
Yeah.
And that's not just my personal experience, chatting to all my colleagues.
Yeah.
Everyone's had the exact same story. Yeah.
Now, I want to quickly touch on COVID because that's going to be something that'll travel with us for a little while. What was your experiences with COVID, each of you? So I'll start with you, Craig. How was COVID? Did that affect you at all in the Northern Territory, or did you feel like it was just something very foreign?
So the Territory was quite unique with COVID. The government acted very quickly, being insulated from the rest of the world. I think the government done the math on this one, and they were terrified that they would lose up to 70% of the Indigenous population if COVID was to emerge in that region. So hard lockdown on all borders, hard community lockdown. I got locked into a town, and there was both police and military on each checkpoint. There was no entry, there was no exit. So
what about if you had to take like if you took a patient or something like that, would they let you go then, or is this just if you wanted to go somewhere you weren't allowed to go?
If that patient had to travel in between towns, we were running care flights, so it was by plane only, and then we really never saw any of COVID itself or the impacts COVID was having. But what we did feel was the lockdowns and the mental health that would occur out of those lockdowns. So a lot of people were suffering in that regard. But we were relatively just untouched.
Yeah.
So in that regard, fortunate to speak for COVID as a virus, as an illness.
Yeah. What about you? What about you, Tommy? How did that compare to you? So you were in London when COVID was at its peak. How did that fare? What was going on around you at the time?
Yeah, so unfortunately, completely opposite. It just started one day. There's a few bulletins, I think, throughout work internally that were on the watch out for some sort of virus that was overseas, but it wasn't yet a concern from us as a service. And I still remember it was probably like February, March, before I even really had a name, that one week was just our general duties jobs, and then next week every single patient we went to had a fever, had respiratory illness or distress. And then from there, it just went boom, boom, boom. And next thing you know, it just basically practice changed overnight. Everything, everything I'd sort of evolved and learned was just out of the door. It was very hard to communicate with patients in all your PPE. I feel like that impersonal touch, which I value so much, was taken away from us as paramedics. I mean, me personally, I remember ever spirit on the car as a solo responder. I did 13 deaths over 6 days just by myself. People waiting 10 minutes for even 999 to answer the phone on cardiac arrest. So if a patient's been in cardiac arrest for 10 minutes, we finally answer the phone. By the time we get activated, get to the job, put our PPE on, we won't even start in resuscitation. We will just go and have a lot of difficult conversations with families. And these are guys who are 60 years of age, my father's age. They're not old.
Yeah, I was going to say that they're not just old people, is it? Like it affects everyone. Like it's
and we basically palliated everyone in a nursing home, and it wasn't that we didn't know what to do. We just were so outweighed. It's like a major mass casualty event in a way, in terms of that the service couldn't cope. We lost about 25% of the service as well to COVID. Not deaths, of course, but just obviously unwell and quarantined and isolating themselves. The hospitals couldn't cope. So you'd go to a patient and typically you might get ROSC or transport this patient, but there'll be no bed for him to transfer to. So there's so much difficult decisions on road. And yeah, just your everyday practice just effectively changed overnight. So I got through the peak of that. And then obviously towards the back end of it, around April, it sort of died down towards then. But chatting to my colleagues, the second waves, and they handled it a lot better this time. They sort of know what to do.
I think they're a bit more prepared now than they were last time.
Yeah, exactly. And it was a bit of a joke at the start. And joke's probably an insensitive word, but it was like, what's this virus? You know, in that sort of culture within the service, and all of a sudden everything changed. Yeah, and we lost a few people, like passed away in our local stations as well. A few of the older guys and girls had been in the service for a while. So yeah, it was pretty tough actually.
Yeah, I think it's the natural reaction of the paramedic to make a joke. You know, black humour. It's quite common right throughout the service. It's something that you need to be aware of and very common. And I think it's our way of coping in some ways of dealing with different situations that we're finding difficult.
Yeah. If a member of the public heard, you know, what you say after a job or something, it'd be very unprofessional and inappropriate, but we just get it, don't we? And that's something that all the guys listening will pick up with their placements and on being on road. As long as it always does stay professional and not earshot of bystanders or the patient's family, then anything goes really.
So just to kind of guide it back towards mental health now, what's some advice, or what are some things that you guys feel is really important for you to do or to remember, just to take care of yourselves and support your own well-being?
For myself, when I moved to the Territory, my biggest outlet for my own mental health was surfing in the ocean. And with Indonesia now closed and borders closed overseas, that release has been taken away from me. So I had to really recalibrate how I deal with my own mental health and to mental well-being, all that. So these are some hard conversations with other people. And this comes down to learning how to meditate, really putting a lot of additional attention into physical health, physical well-being, and that would be everything from yoga to the gym, getting my body into good physical shape, because as you can both agree, night shift is torture on the body, torture on the recovery systems, getting good nutrition, and just putting myself in a position where if I'm physically well, then I can also be mentally well. From that point forward.
I thought you were going to say, it's all right. I thought you were going to say, I think you can both agree I've got a great body before.
As you're gonna go, no, just the job itself is quite taxing on the body. It's taxing on the mental and the emotional.
Yeah, definitely.
And just doing whatever I could to get as many of those ducks in a row, and then from that point
things
forward,
that you do have control over.
Because the job is so out of control and the patients are out of control. Reading good books by smart people about stress and learning about what the mind is all about, learning about how emotion impacts logic and reasoning, and just reading a lot of information on that and giving myself a lot of tools to be able to step away from something emotionally and rationalize it and then come back at it logically. Learning how to do that.
That's good advice.
Learning how to hide my job from my mum. If she had any idea what I'm doing down here, she'd grab me. She'd take me home.
You don't want to upset your mum, that's for sure.
She goes, "How is your job?" And I say, "It's great, it's good. You know, I helped a lot of good people today." I was like pulling up my own hair.
Yeah. She doesn't need to know the finer details, does she?
Yeah, learning how to lie to mum is good for mental health. Yeah.
What about you, Tommy? What do you do? Is there anything different than that?
Pretty similar. I mean, I think just the lifestyle factors are massive for our jobs. So looking after yourself, as Craig said, eating healthy, finding outlets and natural outlets. I took on a bit of a mentorship sort of role towards the back end of London. So I sort of did try to sort of educate myself a bit more. So I could pass on some details to the students had at the time. And I kept reading and hearing about this sort of emotional intelligence rather than emotional resilience. And that's more sort of identifying areas in yourself. Like if you have a bad job, and bad jobs stay with us, but if you have a bad one and it's on your mind for 3 days straight, then that's not right. And that's being intelligent enough to check that and go, okay, well, I need to talk to someone about this. I'm really big on debriefing after a job. I think it's massive for learning points, for identifying areas that were good and identifying areas that weren't so good, but we can improve on for the next patient. So I think debriefing immediately after the job while it's raw is really good. And then just looking after yourself. I mean, I've got some great mates, and you become best mates with the people you work with and the people at the university. But I think it's also equally important to maintain your support network that aren't paramedics. So you have those friends outside of work that you can just go there and say, hey boys, or hey you guys, and there's no work chat. You literally go there and that's how it is. And it's quite easy to get caught up in just your work friends because you spend 12 hours a day with them, more. So
and it's almost like you're trying to escape all of that and, have a bit of a break from it.
Exactly. Definitely. And we haven't mentioned this, but your peers are the biggest support network you'll have. And something I've recognized in myself, and sometimes when like a mate or a peer comes up to you and wants to chat about a bad job, they're not asking for what you would have done in that job. They just want to get off their chest a lot of stuff. So sometimes don't tell them what could have been done better. Sometimes just be an ear to listen to and say, oh yeah, it sounds like a really tough job. Are you okay? They don't need to hear, oh, I would have done this, or did you check this? Because the job's already done. And I'm sure the manager or someone else on that job would have approached it from that side of things. So just be
And do you know what? A lot of people, you'll actually find that most people, if there is something that they could have done different, they probably have worked it out by that stage anyway.
Exactly. So they don't need you to tell them, you dickhead.
I think that's a really good point that Tommy just made then. Like, if somebody comes to you to talk, it's obviously because they are repeating this circumstance or this case over and over in their head, and they really don't need to hear you say you've got the biggest stick and this and that. And they're asking you to listen. And this is a job that stayed. In 3 years now, I can remember all the big jobs that I've been through.
And that's quite a few for you, I imagine.
It's crystal clear where like the job was starting to go through your fingers, and you remember the little mistakes that you made, and you beat yourself up about them because it's like, oh, would have this changed the ultimate outcome? No.
It's not helpful to do that, really, is it?
No, but being able to turn to people, both in the profession,
a little bit of hindsight, but not too much.
But not too much. No. And what Tommy just said then, having your support system outside paramedics, this is critical because I cultivate friendships that do not talk about paramedics every single day. They do not chat shop every day. You want to be able to just step out of that environment, have a breather.
Yeah, it's very easy to get caught up in it. And I think a lot of people do when they first start is get caught up in the lifestyle and the culture, because you do become very close to the people that you work with. But it's true. You need to try and find that balance in there, which is super important in looking after yourself.
Yeah, absolutely.
Now, is there anything else you want to add before we finish? Pearls of wisdom. Come on, I'm sure you've got at least one.
So is this towards the guys in their first semester, Tara?
Well, this is for anything. So we are we're just embarking on our university career. That's
whenever you want. Yeah.
Pearls of wisdom. What do you wish that you'd known then?
All right. So if I could go back and talk to myself 3 years ago, this would be what I'd tell myself.
Yeah, that's it.
Here we go.
To leave the cavalier and the arrogance and this whole cowboy attitude at the door. This is a job, and you are privileged to be in this position. Like, you are there for patient-centered care. This isn't about me or about the clinician. I found that I stepped out of university and I thought I descended out of the sky with wings on my back, and I'm here to save the day. And that really rubs people the wrong way. This is about the patient, and it's learning how to pull yourself and check yourself, pull yourself back into line, And if you see somebody else acting a bit arrogant and it's all about them, to just gently be able to, pull them back into line as well and remind them that this is about the patient. So I think that was...
Yeah. This is a great job where you can lead by example.
Yeah. Be humble.
And this job is easy. You get paid good money. You work half a year. There's a lot of and don't get me wrong. The hours are long, but it's a good job as long as you remain positive.
Yeah.
And always put your patient first.
Yeah.
It's a really. I mean, we all go to, and the guys will realize this once they come on the road. Like, try not to be cynical from the start. Like, don't get caught into the politics of people being in service for years and years.
There's
Just
quite
there,
a few, and even people
first.
that were in your class that are becoming quite cynical. I don't know if you noticed that.
No, I've heard, yes. And I don't think we have the right to. I think no matter how mundane or bad the job sounds, it's the patient's emergency. Just be nice to the patient. It makes your life easy when you go home. You know you've done best by the patient. They love you, and it's a nice feeling as well. Even if we're not required, whatever it might be. Just don't be cynical and just be there for the patient and always put them first.
I like to use the word humility, which fits in well with what you're talking about.
Yeah.
Well, everyone's obviously listening to this because they've joined this degree to help people. So just don't lose sight of that. Really, don't lose sight of why you're here. From a university point of view, CL and Sally will love me saying this, but like. A lot of times when I was studying, I thought, like, do I really need to know this? Like, I just want to treat patients. Like, do I need to know the pathophys? Do I need to know cells? Do I need to know pharmacology? And it's not until you actually go onto road do you appreciate how much that foundational knowledge actually helps you in your decision making.
Definitely.
So although it might seem like, why am I learning this? All the content you're learning for university is there for a reason.
Yeah. Even
the laws and ethics and even the research part, even though you'll never do research.
Well, you never know because you never know what's in store in the future.
Exactly. But no, so just, although it might seem like things are more important than others, still apply yourself, directly to all of it because it does matter. And it's only when you go on road and put that education into practice that you realize, hey, I'm so lucky I did listen to pharmacology or pathophys and I understand what's going on right now with this patient. And it helps you to be a better clinician, of course, as well.
I must say with you two, and this is one thing where you were both outstanding, is that every piece of feedback that you were given on everything that you submitted, you took on board. And I could tell, because I could tell by the next submission that you made, was that anything that you were told and any feedback you were given, you use that to improve yourself. And that's a really important thing to do, especially as you're first starting at university.
Yeah. I think university, and I learned this a year too late, it's a team sport. At the end of the day, there are only X amount of jobs and you're probably going to start doing that math very quickly. But that's up to recruitment to decide. So don't start scaling yourself against your fellow peers. Use them be a team sport. Lift them when they're struggling. Learn from them. Learn off them. I just spent a whole year copying off Tommy.
Seriously, nothing but HDs though, eh?
Nothing but HDs. Help each other every step of the way, and don't fall into a negative culture. Don't talk about each other. Don't see yourself as superior, inferior. Just, this is a team sport, and come together as a team. And because it's the members now that you're going to be talking to, 2 years from now.
It's very true.
And every single person in our cohort has got a job. So there is this massive stress and pressure from everyone. They're like, I might not get a job. Trust me, some might get it sooner rather than later, but you guys will all get a job. As long as you apply yourself at university and try hard and you're a good person, you will get a job. And just be open to that. Don't put too much pressure on just being in New South Wales. That opportunity will always come. Keep your options open and just try hard and things will happen for you.
There is opportunities for everyone out there.
Absolutely. And for the next 2 years, ignore the student rumour mill. I don't know where these rumours come from. There's only 10 jobs. I don't know where.
They just make it up.
And don't speed. don't do anything in the car for the next 2 years.
Yeah.
I can't tell you how many people got knocked back who were good paramedics because their driving license wasn't up to scratch in that first thing. So it might seem stupid, but you do all that work, just don't put the foot down for 2 years.
Yeah.
And then put it,
Yeah, it's not worth it, is it?
No.
No, protect your driver's license, study hard, enjoy the process. I got tunnel vision by the results and the goals and the job that I didn't enjoy the process as much as I should have, or the transition from student to clinician.
I think everyone kind of does a little bit though. Like there has to be some kind of motivation as far as grades go though.
Well, I'm not saying
and that competitive.
But it's only when you actually go out on road and you're, oh, I probably should have listened to what Tara was saying more, because when the baby's starting to crown.
Don't ignore any information. There's two subjects that I ignored at uni, and that was Indigenous health and renal, the bioscience of renal. And I now work in Central Australia, where it's only Indigenous demographic and it's 90% renal. So
there you go. So this is karma. This is karma coming back to bite you for not paying attention.
I just wanted the cardiac stuff, the respiratory stuff.
I know, it's all the exciting. It's the same as everyone. They want trauma, and they want, to deliver babies, and they want, cardiac arrest and all that kind of stuff. But mental health, what component of work, is it that you deal with mental health really? And even when you're doing other jobs, you're still dealing with mental health.
Exactly. I go to psych evaluation, mental health and suicide every single day, 2 or 3 times a day. So mental health is critical. Like lock that down.
Use the tools you get at uni, because they're definitely going to help you.
Yeah. All right. I'll thank you officially for taking time out to chat with me. And it was so good to catch up with you guys.